So I have to immediately say that I'm a systems neuroimager. So we don't have yet much data for you to show with respect to COVID-19, but we are starting a project related to it, and I'm really happy to tell you what we are going to do there and what I think are the potentials of using functional neuroimaging here for this research question. So I will briefly introduce you magnetoencephalography, MEG, which is a functional neuroimaging tool that we are using here in Helsinki, and why I think that it's especially informative in this respect, and how we are planning to use it to study neural networks for understanding the long-term effects of COVID-19. So MEG provides a window to brain functions both in time and space. So with MEG, we measure the activity of neuronal cells in the brain at millisecond scale by addressing the tiny magnetic fields that are produced by the neural activity. These fields are undisturbed by the skull and scalp, and thus the localization accuracy of MEG as a method is also very good. The magnetic fields are produced by tens of thousands of simultaneously activated neurons, but they are still so small, in the order of femtoteslas, that we need special sensors for measuring them, which makes the technique at the moment really expensive, and thus it is not commonly available. Nevertheless, of the functional neuroimaging techniques depicted on the right low corner, MEG provides the best spatial and temporal resolution, and thus it makes it really optimal for many research questions. MEG offers multiple views to brain function. So we can look at local activities as signal power fluctuations, as shown here on the left side of the figure, and in this small video, which shows you the brain activity in 10 millisecond steps. We can also look at different frequency band, like shown on the right part of the figure. But really importantly, MEG provides us a picture of more global activation networks in the brain. And for example, we can learn which areas are functionally connected to each other. MEG has already several established clinical applications. Especially here in Finland, we have a long clinical routine for using MEG in preoperative assessment of epilepsy surgery candidates and also in brain tumor patients. In epilepsy, MEG helps in locating the sites of epileptic activity. And both in cases of epilepsy and tumors, MEG can be used to locate the functionally important areas, like the hand and foot motor areas, speech areas, like shown in this lower brain figure with these colorful dots. And importantly, we can locate the distance of these functional areas to the tissue to be operated for guiding the surgeon. Especially in the case of epilepsy, there's internationally increasing demand for these mappings, as the method is not that commonly in use. So, for example, in Finland, we are not serving only Finland, but we are serving also Norway for these patients. So the patients fly to Finland for these mappings. Well, MEG is developing several new applications as we speak. I think we are really in the pacing new era in the use of MEG. And there are several new applications coming in the future years where MEG appears really potential. And why I bring up here one of the examples, mild traumatic brain injury, is that symptom-wise it links to the infection-related disorder that we are now also starting to apply MEG for, that is long COVID. So mild traumatic brain injuries are also very common, and we don't have very good diagnostic tools for them in our clinical practice at the moment. In many of these patients, structural imaging with CT or MRI remains negative, and the clinical symptoms in these patients are often very variable and non-specific, like fatigue and different cognitive problems related to memory and attention, for example. Both us and others have recently shown that it's possible in the acute phase with MEG to detect neurophysiological alterations in these patients, for example, pathological slow wave activity and more global network disturbances, which then do disappear with time as the patients recover. Well, now to the long COVID. So we are starting a long COVID study here in Helsinki, also in other places, but Helsinki is coordinating the study. And so this long COVID study is a 4-year Horizon Europe project aiming at understanding the mechanisms of host virus response behind the long-term symptoms following some of the patients after COVID-19 infection. The project aims at conducting geographically diverse cohort and register studies, mechanistic studies, and novel biomarker analysis, and also conducting interventional and follow-up studies on long COVID symptom patients. As the most common symptoms in these patients actually include fatigue and cognitive dysfunction, it felt really logical for us to ask whether we could also use functional neuroimaging, mainly MEG, in long-term symptoms after COVID-19 infection in a comparable manner than we are using in the mild traumatic brain injury. So to get some objective markers of the disorder and also to understand their possible underlying neurophysiological mechanisms. So in the whole study, 3 cohorts will be included in Finland, Switzerland, and in the Netherlands. As you can see from this figure, there will be very many biomarkers collected from these subjects with partial overlap over the cohorts. Here in Helsinki, we will measure part of the cohort with MEG. Our MEG subcohort will include long COVID patients with neurocognitive symptoms, subject with confirmed SARS-CoV-2 infection, but without cognitive symptoms, and an age-matched control cohort before the COVID era. The measurements are planned to start later this year, and the results will be correlated also with the fairly intensive neuropsychological testing that will be conducted on the participants. So we are definitely not the first ones interested in the possible neurophysiological findings after COVID-19 infections. So there's already something that is known. So for example, in a recent study in an Italian cohort, disturbed slow wave activity that was actually qualitatively quite comparable to our mild traumatic brain injury patients was observed soon after the infection. And this correlated with the verbal memory deficits in these patients, and it normalized in a follow-up of 10 months in a majority of these patients. So I will conclude by saying that I think that with functional neuroimaging, we start to be at the point that we have tools to bring data efficiently together. We have several excellent methods to study subjects' brain structure and function. We often have relevant behavioral and symptom-related data from these same subjects, and more different kind of clinical data for use, for example, genetic information and all these various biomarkers that will be collected also in this future project. So I think long COVID project will be a really interesting also from the point of view of bringing datasets informatively together for learning more of the many still hidden underlying factors behind our non-invasive system-level neurophysiological signals. So I will stop here. Thank you for your attention.
Yes, so good afternoon. My name is Tiina Saanioki. I'm the node manager of the Finnish Biomedical Imaging Node. So it's great to see so many people here at the user forum today, and I'm very happy to introduce our node also. So first of all, I want to highlight FibinoD's 4 spearhead imaging technologies, which are preclinical and human PET imaging, preclinical high field MRI, human magnetoencephalography, and preclinical optical imaging. So if you happen to need any of these technologies or some special technique of them, or maybe a certain radio tracer, for example, I very much encourage you to contact us, as we are very proud to have world-class expertise on these technologies. The key research focus areas of the FibinoD include cardiovascular and metabolic diseases, neuroscience, cancer, inflammation and infectious diseases, and as well as development of new radio tracers for such research and diagnostics. So yeah, all in all, our node offers very versatile services covering both basic and clinical research, and of course we offer very extensive solutions for translational research and drug discovery. Thank you.